Chapter 2: Immediate Care of the Newborn. Chapter 2 of this self-instructional module tackles the immediate care of the newborn in the first few minutes and hours after birth. At the end of this chapter, you will be able to describe, in sequence, the step-by-step procedures that a health worker should perform to meet the immediate basic needs of every newborn. This training module will consist of videos interspersed with photos of vaginal births. Take note of the running time displayed at the lower left corner of the screen. This indicates the period within which the action must be carried out. Let's start with the preparation for a vaginal birth. Ensure that there is privacy at the delivery area. The area should be draft-free at a temperature of 25 to 28 degrees centigrade. Prepare your needs. Lay out 2 pairs of surgical gloves to be worn by the health worker that does both perineal support and cord clamping, 2 warm blankets, a bonnet, a sterile plastic clamp, an instrument clamp, and a sterile pair of scissors. Wash your hands following the prescribed 1, 2, 3, 4, 5 method. Put on both sets of gloves. This is a double gloving step. Remember that more than 90% of newborns breathe on their own without problems. If the baby is crying or breathing normally, do not suction because routine suctioning is potentially harmful. Suction only if the airway is obstructed. During the first 3 minutes within birth, here are the correct procedures prescribed by the EINC protocol. Once the baby is out, call out the time of birth and sex of the baby.
6:49. Baby.
Lay the newborn on the mother's abdomen. Towel dry the body of the newborn. Dry the baby for at least 30 seconds. This will stimulate the baby to breathe. Do a quick check of the baby's breathing and tone. If after drying, the baby is limp and not crying, support breathing by bag and mask ventilation. Continue to keep the baby warm. Do not wipe off the vernix as this continues to provide a natural protective cover for the baby. Do not wash or bathe the baby within his first 6 hours of life. Washing could lead to hypothermia and infection. Remove the wet cloth. Initiate skin-to-skin contact by placing the baby prone on the mother's abdomen or between her breasts. Use the second linen to cover the baby's back. And place the bonnet on the newborn's head, both to keep the infant warm. Place ID bands around the newborn's ankle. Skin-to-skin contact is essential to provide warmth and create the bond between mother and child. Increasing the chances of overall success of breastfeeding, allows colonization with good bacteria, protects the baby from low blood sugar levels. Wipe the soiled gloves with the wet cloth used to wipe the baby. After excluding another baby for delivery, inject 10 international units of oxytocin into the mother's arm or thigh to prevent uterine atony and bleeding. Remove the first set of gloves prior to handling of the cord. Do not cut the cord immediately. Feel for the cord and wait for the pulsations to stop. Clamp the cord at 2 centimeters from the base of the umbilicus using a sterile plastic clamp or tie. After applying the first clamp, the cord may be stripped of blood away from the baby towards the placenta. Apply the second clamp at 5 centimeters from the base to the umbilicus. Using a sterile pair of scissors, cut the cord as close as possible to the first clamp. Waiting for 1 to 3 minutes or until the cord pulsations have stopped prevents anemia and protects preterms from intraventricular hemorrhage. There is no need to dress the cord or apply 70% isopropyl alcohol or use binders or big kiss. The cord should be allowed to air dry until it falls off. While maintaining skin-to-skin contact, check on the mother's condition. To deliver the placenta, ensure that the uterus is well contracted. With one hand, apply controlled traction on the cord while the other hand is positioned at the area of the woman's symphysis pubis to provide counter-traction. When the placenta is out, continue uterine massage and feel for its contraction. Proceed to check how heavy her bleeding is and examine her perineum, lower vagina, and vulva for tears. Clean the mother and keep her comfortable. Inspect the placenta. At about 20 minutes to an hour and a half after birth, the baby will start licking, rooting, and tonguing movements, cues that he is ready to breastfeed. Encourage the mother to nudge her newborn towards the breast and seek out the nipple. Breastfeeding that is started within the first hour of life offers the greatest protection against infection. Do not give glucose water, sterile water, or formula milk. Counsel on positioning. The newborn's neck should not be flexed nor twisted. The newborn should be facing the mother's breast. The newborn's body should be close to the mother's body. The newborn's whole body should be supported. In the cradle hold, the baby's head is supported or cradled in the crook of the mother's arm and the buttocks in the hand of the mother. In the cross cradle hold, the arm opposite to the breast supports the baby's buttocks and trunk with the mother's hand cradling the baby's head. In the underarm hold, the baby is clutched or supported by the same side arm as the breast but close to the mother's trunk. As in the cross cradle hold, the buttocks and trunk are supported by the mother's arm with the baby's head in the palm of her hand. In the side lying position, both the mother and baby are lying on their side facing each other. The mother supports the baby's body with her arm or with a rolled blanket. Counsel on attachment. The newborn's mouth should be wide open. The newborn's lower lip should be turned outwards. The newborn's chin should be touching the breast. Suckling should be slow and deep with some pauses. Let the infant remain in the mother's arms as she recovers from giving birth. While the mother and newborn are together in skin-to-skin contact, the mother should be in semi-upright position so that the baby's head is higher than the rest of the baby's body. Within the 1 to 2 hours after vaginal delivery, the mother and baby should not be left unattended. Both mother and baby are monitored for bleeding and breathing and other signs of problems. The health worker should monitor the mother and baby diet every 15 minutes in the first 1 to 2 hours after birth. When the mother is transferred from delivery table and transported to the room or ward, the newborn is best positioned prone on the mother's chest with the head turned to one side. The baby may be washed but only after at least 6 hours. The step-by-step method of essential intrapartum and newborn care is doable even for a cesarean section birth. The baby is first positioned in between the mother's thighs where drying is carried out. Next, the cord is palpated and once pulsations have stopped, it is clamped and cut as previously demonstrated. The baby is then brought and assisted for skin-to-skin contact on the mother's chest. Non-separation of the mother and baby follows to allow for early initiation of breastfeeding. In summary, here are the step-by-step methods outlined in the Essential Newborn Care Protocol according to World Health Organization standards. Drying for at least 30 seconds with rapid assessment of breathing and tone, early skin-to-skin contact, properly timed cord clamping, and non-separation of the newborn from the mother for early breastfeeding initiation.